Hello, Facebook family. I got to start that again. Welcome to Saturday Online Clinic. My name is Regina Askia Williams, and I'm reaching you from New York City. Okay, it's always a pleasure to have you. It's a thing of joy to see when people comment from Australia, from South America, from London, from Nigeria. Welcome. It's always a pleasure to have you. Please keep your comments coming in the comment section so we can gauge where you are calling from and tailor our messages to meet whatever problems are going on in your area. Okay. All right. Today I have with me a big personality in the person of Dr. Mini Murthy. We're going to meet her shortly. But before I bring her on, let me say thank you to all of you who have been reaching out to me with messages of encouragement, how you enjoy this program, how you learn very much from this program. This encourages us to do better and to bring you more. Okay, so keep your comments coming, keep the encouragement coming. We love it. All right. Okay. In the past days, I was a judge on Miss Earth 2020, a virtual talent show competition, and I was very impressed by the know-how and the knowledge the girls had in terms of communicating with the can we have quiet in the studio, please? I'm sorry, guest. All right, we're bringing our guest on soon, but let me just say thank you to the organizers and the winners. Congratulations to the winners of Miss Earth 2020. You all did a good job. Okay, so keep it on. It's important that Nigerians get to know that climate change and climate change issues and global warming is real, and that the oil companies in Nigeria consider investing in a reconstruction of the environment they have destroyed in the southern parts of Nigeria. The oil-soaked riverine areas and the oil-soaked farmlands make it impossible for the locals there to make a living, especially as most of them are farmers and fishermen. Okay, thank you very much. Kudos to the organizers, Ibinabo Fabrissima. That was a good thing you did. Thank you very much for being in the front line of that campaign. I also want to encourage all of you to get off your couches. I know it is the COVID lockdown, but you just don't sit there and do nothing. Get involved with your community, okay? Get involved with all the projects we have going. I want to invite you all at this point to join us at Superstars 2020. Superstars is a celebrity cookathon where celebrities come together and do a cooking competition where they highlight the values of African recipes, how you can use food to heal yourselves. They promote the local chefs, they promote the local recipes, in a fun environment where everybody gets to learn, to interact, mingle, and be happy. All right. So Superstars 2020 will focus on how much of an impact a chef would make in his environment, in his or her environment. So I want to encourage all of you all to go to superstars.com and register to be a part of Superstars 2020. It is big. It's going to be big. All right. We already have so many people waiting to sponsor, waiting to broadcast this. So if you have a business, if you're a chef, if you are a person who wants to be in this competition, please go on superstars2020.com and register to be a part of it. Okay. 2020 was supposed to be the year of the nurse. Okay. And COVID is not going to take that from us. RAIN Project 2020 is going to showcase and honor the frontline workers for all the effort they did through the COVID situation. All right. So stay tuned and watch these pages for announcements as we proceed with RAIN Project, RANE, Regina Askia, for Nurse Excellence Project in our campaign for Nurse Excellence in Nigeria. Okay, register and be a part of that project as well. For all of you who sent in your videos, all right, to the ongoing 1 million face mask campaign, we received your videos. They were very entertaining and very educative, and 27 videos have been chosen out of the lot, and this 27 will be showcased on NTA Network in Nigeria and other media outlets. So stay tuned to watch and help us vote for the best videos, okay, from the 5 regions of Nigeria. This project is going to go into phase 2, where we will provide 1 million face masks for 1 million Nigerians, okay. we will value your participation and support. All right. Having said that, I want to welcome our guests, Dr. Mini Murthy. After Dr. Mini Murthy, we get to speak with Queen Choma Agotu. Okay, we'll talk with Ms. Choma about Nigeria, about Biafra, and about what it takes to be an immigrant, an African immigrant in the diaspora. All right. So please, ladies and gentlemen, help me welcome Dr. Mini Murthy. All right. Dr. Mini Murthy. Do I have Dr. Mini Murthy with me? Dr. Mini, it's
Thank
a
you.
pleasure
Thank you
to have
so
you
much,
with us.
Regina. It's always a pleasure because not only is it a pleasure as a colleague in healthcare to interact with you, but also a friend and, co-conspirators in the various things we do as immigrants living in the land of United States of America. And
Yes.
also, as I always say, yes, I was born in India, but I have a teeny bit of African blood in me because I just love the people from the African continent. So, that being said, thank you again so much for having me on your show. And hello and greetings to all our, what do you call it, viewers from all over the world. So, good morning, good evening, good night, good afternoon. So, let's get started.
Yes, let's get started. All right. And Dr. Mini, we have a lot of people watching us. So as they send in their questions, I'll be reading them out to you. Okay.
Great.
So your resume is vast. Okay. And for me, you have been like a yardstick I look up to. All right. I want to be like you. I
You're
want to be
very
as
kind.
accomplished as you. I want to be able to make and impacts globally as you have been able to do. So let's talk about the recognition you got, the Elizabeth Blackwell recognition. What is that recognition about?
Okay,
And how did you get to getting it?
thank you so much for your kind words. I mean, you are so accomplished in your own right, a beauty with brains. So
Thank
that
you.
I just wanted to say, and also with compassion. This is the thing, Regina. What ties us together is the compassion and the passion we have for doing whatever we can to make a positive change.
Yes.
So, the Elizabeth Blackwell Award, actually, of the awards I have received, is very special because I was the first Indian born American in more than 70 years to get this, and only the second Asian, and one of the very few colored women to get this
Mhm.
award. Now, Elizabeth Blackwell was the first woman physician in the United States of America. She came here from England, and she was really a role model because she broke the barrier. Do you know how many schools she applied to refused her admission because she was a woman? And she started a medical school in New York and a center to help women and girls. So Elizabeth Blackwell was amazing. She has broken so many barriers. And the American Medical Women's Association has this medal, the Elizabeth Blackwell medal,
Yes.
which I can hold up if you want.
Yes, please go ahead. We
uh,
want to see it.
yeah,
Yes.
sure. It's right here. I'm just holding it up. And the interesting thing about this, it's given to a woman. There, you can see it.
Oh, congratulations again. Yes.
So
Beautiful.
this is this award. It's actually a medal, and it's given to women physicians in the United States who just don't do only medicine. They just don't practice medicine. So this is really an honor. And when I was a young girl growing up in India, Elizabeth Blackwell was my heroine, and for me, this was my cup of joy that I was, I got this award. But that being said, the reason I'm saying that is because you see, we all need to believe and do what we can to go over it. So if obstacles come, I tell my daughter, I tell my students, especially as women, we have, Regina, you know that we
Yes.
face a lot of issues, especially if you're a colored woman. It
Yes.
just gets a little harder to do it. But guess what? All the white matter and the gray matter is same. The skin
Yes.
color just depends on the pigment, melanin. And
Yes.
I am quoting my daughter Aishu, who when she was in second grade was asked to give a talk, and then she said that people look different because the skin has different pigment in them. that is the scientific basis. So what I'm trying to say is we need to look beyond this. And thank you so much for having me on your call today, because this is the 75th anniversary. This is the day the UN Charter was signed
Oh,
75 years ago.
yes.
And I put that on Facebook and I tagged you too, because
Mhm.
it's like, and it says that nobody can be free. We are all free only when everybody is
It's
free,
free.
you know?
Yes.
So that's, and the freedom is just expression to do what you want to do right. So I think it's so important that we, and you were talking about the masks, that this is what we've been doing. I've been doing personally and working with my NGO, American Medical Women, and other NGOs. We've been supplying masks to our colleagues, physician colleagues, and also to the community, especially those who need it, like in the homeless shelters. So if you can make masks or donate masks, that would be really cool. Oh my God, Regina, I don't believe you put up that.
All right. So let us talk about,
Thank you.
I know that you are in a Nigerian Medical Association. You have done some work, because this picture here shows some African women with you.
Yes, yes,
What work
yes,
have you
yes.
done in Nigeria?
Okay, so basically, I have, um I think I briefly got cut off there. It said you're
Yes,
going
yeah, I'm
live
sorry
again.
about that.
So,
Yes.
so this is when I was installed as the Secretary General of the Medical Women's International Association. That is Joyce Barber, excellent president, the past president of the MIVAN, the Medical Women of Nigerian Association,
Mm-hmm.
giving me a sash. And we have worked very closely on a lot of issues, collaborated, especially with the Dr. Joyce Barber, Rosemary Ogu, Eleanor Morinobi, who's now the president of MWIA, my colleague, I'm the secretary general.
Yes.
We all have been working and addressing violence against women. And it's so important this year, Regina, and all listeners, because this is the 25th anniversary of the declaration of the Beijing platform
Yes.
for action, for women. So,
Mm-hmm.
Beijing platform for action. And so, what happens is we and women are the ones who need to be on the top here, because unfortunately, we are neglected. Why should we be fighting for gender equality now? I mean, that needs to go without saying.
Yeah.
It's not a dole which is somebody is giving to us. you know
Mm-hmm.
we are women because of the gender and the biological makeup. The chromosomes we have, as you know, are XY.
Yes.
So, and then we have XX for us and XY for men. So what I'm saying is, I think we need to work together. So with Mivan, I really congratulate my colleagues and friends at Mivan for their tireless activism in
Mm-hmm.
addressing this. And AMVA and Mivan worked together through MWIA, and we we sent some PPE and funds to Italy.
Okay.
So this is the great thing. Even though Nigeria is affected, the United States is affected, we
Mhm.
all got together on a common platform to
Yes.
send out PPE and donations to our Italian colleagues.
Yes.
So Mivan is a part of the Medical Women's International Association, which was established by an American physician in 1919. We celebrated our 100th anniversary last year. And thank God it's not this year, otherwise, nobody could come. And we were so happy to welcome all our colleagues and physician sisters from all over, including Nigeria. And unfortunately, the conference, which was in Nigeria, I was planning to go to your country in September, but that has been postponed to next year, rightly
Yes.
so, because nobody can travel now.
Yes.
But Mivan is very active, especially, Rosemary Ogu, Joyce Barber,
Yes.
the current president, Dr. Osioji, and
Mm-hmm.
Eleanor Mardinobi, Dr. Mardinobi, who is the president of MWIA now.
Yes.
we all work together to address violence against women.
Okay.
And we
Thank
will
you.
be having
Yeah.
a cyber event. I will send you the information,
Yes.
because CSW, we could not have any events, so
Yes.
now Amber had one, so we're all doing these cyber events. I will be letting you know. So
Thank
I
you so
really
much.
appreciate the work they're doing. Thank you very much.
Okay, thank you. Now, let's talk about violence against women. We've been many years after Beijing, and in between, we have been having, recordings of events or situations where women have really been treated violently. These
Yeah.
cases are being recorded still across the world, meaning that our work is not yet done. Okay, but in situations of COVID-19, we
Mm-hmm.
see an increase in the numbers
Yes.
of reported cases and more violent nature, of cases are being reported, or the cases are getting more violent in nature. People are being killed. Children are even being harassed. What is going on? What is it about the situation, the lockdown situation, that is leading to this type of, increase in the number of reported cases of violence against women? We're hearing of rape, we're hearing of acid attacks and all kinds of things. Could you say something to that situation too?
Oh, yeah. Thank you so much. Unfortunately, the reports released by the UNFPA and the UN Women say that for every 3 months of a lockdown, UNFPA, that's the United Nations Population Fund,
Yes.
indicates that 15, Regina and listeners, 15 million more cases of domestic violence around the world will increase. Because the challenge we are facing is these people are in the same closed space along with their perpetrators. And unfortunately, a lot of them have lost their jobs because
Mhm,
many women work in informal sector. And even if the man in the house has lost his job, the stress is taken out on women and the
mhm.
girl child. And where can they run to? Because even they have all the avenues they have may be closed. So this is a challenge. So I just want to share briefly with you and the viewers, and again, just to give a shout out to you. I mean, it's this is like really what you're doing is amazing because you're connecting people through COVID. So I'm giving your
Thank
program
you.
a new name, Regina: Connectivity in COVID. That's the so.
Thank you.
So what I wanted to say is, so what is being done? Um, so some of the global strategies, the UN Women, according to the UN Women report, which was just released, they
Mhm.
have been working together with other UN agencies, and so countries like Kenya, Trinidad, and Tobago are making use of technology because
Yes.
the courts are closed, but they're making use of technology to address the issue of gender-based violence.
Yes.
Similarly, pharmacies and supermarkets in Europe and Spain are a part of a safety network, and they have put into place emergency warning systems. That means if somebody is being abused, they can reach out because pharmacies are open. Remember,
Yes. Yes.
pharmacies are essential, they are
Yes.
not closed, so they can reach out to the people in the pharmacy. So this is something which I really want to stress, that if anybody knows somebody who's in a relationship, who's being abused, ill-treated, they cannot think they have no avenues, because these are what some of the things which are being done. The other thing is in Somalia. Do you know what they're doing in Somalia, the
What?
United Nations Development Program? Let me tell you, just a
Yes.
minute. They have partnered with the local communities and have neighborhood watches
Neighborhood watches. Okay.
even during COVID. So maybe during the non-curfew time, if you go, so again, you see, trying to address this with the resources, because you may not be able to go to a shelter, they may be closed. And also in Mexico, UNDP is working with another UN agency like UN Women, as we know, to use phones and online platforms. Remember, everybody may not have internet, but you have a cell phone. So there's a way of texting people. They're reaching out to them by the Luna centers. You can Google it, listeners. It is LUNA, Luna centers. So they have created these safe spaces for women. And guess what? This is a great example of partnership between the United Nations, the public and private agencies. Moving on, in the Dominican Republic, UNDP and banks have created a partnership to facilitate referral services. For example, if the bank knows that a woman is being abused, they can report it. You see? So even the bank employees are being trained. And with the European Union, the UN agencies have launched what is called a Spotlight Initiative to assist 50 million beneficiaries across 25 countries. It's just been announced. So watch this space for, like go onto the UN Women
Mhm.
website to see what is going on.
Mhm.
But what I wanted to say, the other thing which is important is women need not think they are alone in this. Yes, we all go through issues,
Yeah.
but there are some platforms. And you know what? Like if you can go to a pharmacy, if you can go somewhere, tell people. That's why I think it's so important, because we have so many mental health issues now
Yes.
because we feel lonely. And programs such as yours, connectivity in COVID, you
Yes.
know help people to come together, because it's like you're talking, you have a platform to
Mhm.
express it. So these are some of the things. And the other issue we need to be very vigilant about, in so many countries they're getting girls married very young now
Mhm.
because schools are closed. So you see, we have gone back with regard to reaching the targets of the
Regression.
sustainable development goals, in my opinion, especially if it relates to education and gender empowerment, which is SDG 5, and even SDG 3, which is health.
Yes.
Because what is happening is parents are worried and they want to get their girls married off. So,
Oh, yeah.
increased incidence, Regina, of forced marriages. So, programs such as these help us to discuss these issues, because you know what? This and the other thing women are facing
Mhm.
is lack of sanitary pads.
Yes.
So let me tell you something, and I will get back to you. Maybe we can work. I am at the moment working with an NGO who has launched recyclable pads. That
Yes.
means these pads are made out of special cloth, a
Yeah.
special technology. We're just testing it out now to see how this works. Because to me, in addition to the other indignations, a woman not having a pad or
Yes.
some kind of protection when she has a period, which is a natural phenomenon,
Yes.
this is the platform. We should not shy away from talking about a period, because
Yes.
a lack of a pad is also, in my opinion, gender based violence,
Mhm.
lack of access. So we need to see how best can we come up. Like what we have is, we have the Diva Cup. The problem with these is, Regina, is if there's no clean water. So this is an issue. Oh, I got cut
All
off.
right, I'm still here. I wanted to give you the screen. Now, are you
Thank you.
aware of any UN actions or UN activities in Nigeria? You have mentioned a lot of United Nations projects across Africa. Are you aware of any in Nigeria that our viewers who are mainly Nigerians can avail themselves of?
Yeah, just give me a minute. I will tell you. The reason I did bring about other places is because, it's just to educate people, but definitely there is the UN Women's Office in Nigeria,
Yeah.
and also the United Nations Development Group. Because the interesting thing is, whether I just want to make you aware, is the Federal Republic of Nigeria, as you know, in 1960, that is the time it became a member of the United Nations. That means it was um, admitted as a member of the United Nations. And you have so many NGOs there who are working with the UN. So I think the what are called UNICs, Regina, that this is what you need to be looking into. For example, this is called the United Nations Office for West Africa and the Sahel.
Yeah.
And also there are the unix of the United Nations Information Centers.
Yes.
So for the Nigerian viewers, I extend my greetings to you, and I love you guys, and I just want to visit your country. It just didn't happen this year. Hopefully it will happen next year, because it would be so nice to see Nigeria. And hopefully I can, if my daughter is free, she can go with me. So the projects in being implemented in Nigeria, for more information, you can go onto the UNDP Nigeria and look for a list of projects, because one of the things they are doing is UNDP is working with local partners in Nigeria for food security,
Food security,
especially
major.
in the northern part of Nigeria.
Yes. Okay.
Okay. And also, UNDP is working with the local governments to talk about the Niger Delta biodiversity resources as well, because you have pretty fertile land. And also, the other thing which we all need to be aware of is now they're partnering very actively with Nigeria in
Yes.
the environmental management and disposal of PCBs. As you know, PCBs is a major challenge. So how do we get rid of the polychlorinated biphenyls? That is the full term for a PCB.
Mm-hmm.
And do you know that even in on beaches they are finding in fish these small PCBs? So we need to be so careful. And the other thing is the UNFP, UNDP, and FMARD are holding a communication project. So
Yes.
that is something I would like to tell you. And that your FMAD, as you know better than me, is your Federal Ministry of Agriculture and Rural Development. So
Yes.
you see, there is a lot of work, and even the WHO is working with Nigeria, with the NGOs and the local office. So for
Yes.
those viewers, I would say please go onto the United Nations website, look at what the UNDP is doing in Nigeria, and look at how they are reaching out to the people. But I just want to say something. I was on an executive meeting yesterday, because I'm on the Department of Global Communication, the NGO, a global NGO, which is affiliated with them. So one of the things should be, what I'm saying is, one of the issues is that it's taking time for people to get back. So have patience, but somebody will get back. And I just see a question here. Rape crisis, women and children are no longer safe. How do we work together to resolve this issue? Okay, so this is $1 million question.
Oh my goodness. Yes.
May I take this? And
Yes,
thank you
please.
so much, Jane, for your question. To the best of my ability, based on my experience as a physician and a public health expert, you need to talk to people. We need to empower women. And this comes when they feel safe. Because remember, Regina, we were having a discussion yesterday, and I said in some countries, the laws are so prohibitive and restrictive to women that when you're
Yes.
raped,
They're
a woman is
embarrassed to
raped.
talk about it and afraid to
Yes,
talk about it. Yes.
yes, and they cannot go to the hospital till they get a certificate from the legal people, like a police person.
Yes.
And oftentimes, a woman faces against sexual assault.
Yes.
So one of the things I think, and I want to share this story,
Mm-hmm.
is which really happened. So it's not a story, it's an anecdote.
Mhm.
So this we need to work at together at local communities. And this is the thing, we need to write letters to the women parliamentarians. I'm always writing to people, tweet about it. If 100,000 people tweet about rape, don't you think somebody will take notice about it? Or they
Okay.
have to. No, to a certain extent. It's like, I'm not saying like the minute you do it, but it's a gradual process.
Yes.
So
Yes.
we need, and also we need to have men working with us.
Yes.
That is the most important thing. So I always say, in the spelling of woman is a man included. So
Yes.
it's woman. So
Yes.
it's wo, not wo man, as some of our male colleagues joke or something like that. But I'm just saying that this is important. And at a local level, just to answer Jane, one of my students was a nun, and when she was in one of I think when she was in Ghana, there was this woman who was being abused every day by her husband. So you know what they did? My student got together women in the community, and when one day the man came home drunk, all these women were in that hut, the little house of the woman who was being abused. They threw pots and pans at him, 25 women, when he came home. So,
They
and you
could
know
get
what?
arrested for being
No,
violent.
no, 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 they did. But you know what? Let me tell you, he stopped his abuse from that day. He said it hurts. So, my student asked him, "You've been hurting your wife every day."
Yeah.
So, what I'm saying is, this the reason I wanted to share this is we can come up with some local action depending on the scenario.
Yes.
But I think talking, I mean, look at what happened after George Floyd's
When
unfortunate
everybody
murder,
spoke up. Yes.
because we all got together. I mean, I am not African, but I feel for it
Yes.
because I'm a human being, right? It could have happened to anybody. So that's what I just want to say. Again, there's somebody else who say, yes, a lot of women are afraid to talk about their experience when it has to do about rape. Absolutely, because it's the culture of shame or the culture of
And
silence. So
silence.
that's why we need to make sure, as women, as NGOs, that they have a safe platform.
Yeah.
And Regina, I think now with the explosion of the internet and technology, we
Nothing should
can
be
make
hidden.
it even more effective.
Yes.
We need to talk about it, and it's nothing wrong. Like, for a woman to stand up and say, I was raped, it takes a lot of courage.
A
She
lot of
should
courage.
not be blamed.
And
But if
I have to say, Professor, many Nigerian women have been able to find a voice to come online and state, okay, or say what happened to them. What falls short is how the government follows up, how the security agents follow up. They kind of do not really support these women, and at the end of the day, they come out and say this. A lot of noise gets made. People kind of sweep it under the rug. At the end of the day, they are sad that they were bold enough to come out, because nothing comes of it. So the rest of the people who were victims get victimized again. They are afraid, they are silenced, and they step back into the shadows. And then the abusers continue in their cycle of, perversion, which should not happen. So a situation where the Nigerian government or African governments will give more teeth to the laws that protect the woman who claims to have been raped, should be encouraged, So this is a time that activists and NGOs should really come out in support of the women who say they have been raped. And I thank all of you, Mirabel Homes and organizations like that in Nigeria who cater to people who have been raped, who cater to women who have been beaten, who cater to even men who have suffered violence. I encourage you to do more, especially to break this culture of silence amongst women who have been victims of rape. And Professor, you have made a lot of points today. What really got to me was encouraging men to be part of this project, because we cannot stand alone. We all have sons, brothers, uncles, and father figures, in the churches, all around us. So if our male counterparts can constitute themselves into a group that will protect the sisters in their neighborhood, the women in their neighborhood, it will be a good thing. So if you hear that a woman has been raped, you guys will go talk to this person, follow up with the legal situation, and ensure that justice has been, secured for the woman who was victimized. And, we'll take it from there and perfect this situation where the women get hearing and get some kind of reparations and some kind of considerations for having suffered that kind of brutality. So you have made so many useful suggestions, and I hope that people listening will be able to build on that and run with it. Yes.
I just want to say one last thing. Thank you so much.
Thank
There
you.
is
Thank
what
you.
is called the White Ribbon Alliance,
Yes.
which is men working against violence. So
Yeah.
I would strongly suggest check it out. It's
Hmm.
White Ribbon Alliance, and
White Ribbon
see,
Alliance. Yes.
yes, and see if they will partner with people in Nigeria. It just
Yes.
takes one man. Remember, he for she, because
Yes.
that was launched by former Secretary General Ban Ki-moon, where
Yes.
men are for she. So it was, and it came about because that was actually Ambassador McDonald, former ambassador from Suriname,
Yes.
worked a lot about it. And when I asked him, he said he started talking about this in the barber shops.
Uh
So
huh.
about how men cannot be macho just by
Yes.
beating up a woman, but by helping a woman. So
Yes.
you see, Regina, my last thing I would like to say before we are done is machoism is not beating up a woman. It's showing your strength in helping a woman to help her healthier families and better
Hmm.
communities. So
Hmm.
that's what I want to say. That I think the toxic masculinity has to be changed. This comes by talking. And you know
Yes.
what? Hey, you Nigerian ladies, you are strong, you are committed. When we have this conversation, maybe next year, things would have improved a little. Thank you
Yes.
so much.
Thank
Signing
you very
off.
much for spending your afternoon with us.
Thank
It
you.
was
It was
such
an
a
honor.
pleasure. And then I'm sure that our viewers have learned a lot from your suggestions. I definitely have. And I'll take a few of those and run with it. And next time we'll meet, we'll be talking about steps we have taken after this
Yes.
interaction. Thank you
Thank you.
so much.
Bye.
Bye bye. Have a great day.
You too. Stay safe, everybody.
Dr. Mini? Dr. Mini, are you
Yes.
in a rush to give a lecture or something? Can I take a little more of your time to talk about COVID?
Oh, yeah, sure.
All right, before you go, because we can't have a doctor in the house and you don't give us updates on COVID. That is a big situation going on right now. Okay, so do you have any updates, any new news? Because we know that this virus keeps changing. Information coming out on this virus keeps changing. So if you can share with us what you know about the new information on the virus and the new updates on how we should take care of ourselves, I would really
Okay.
appreciate.
Thank you so much, Regina. Without sounding redundant, it is using personal protection,
Yes.
hand washing. I just want to talk about this. I'm answering the second part of your question before I go on to the first one.
Yeah.
Hand washing. And you know what? You wear a mask to protect others too.
Yes.
So if everybody wears a mask, and Dr. Anthony Fauci, who's the United States and actually one of the world's leading experts on infectious diseases,
Mhm.
said by wearing a mask, we can bring down the number of deaths in this country by more than 30,000
Yes.
before October. So one of the things which we really need to be careful about is we cannot discard hand washing. And just the latest update is there is a list. The FDA has said that 9 manufacturers of sanitizers, 9 kinds of sanitizers should not be used because they can cause harm. So please check that. But if you're at home, there's nothing like a good rub with soap and water and
Mhm.
making sure you rub even between the web spaces in between your fingers. Now, the update is very, very grim. I don't want to sound like a pessimist, but I'm being a realist here. 30 states in the United States has gone up. Why? Because the young people think they're invincible. They go to Florida, they go to Mexico for a holiday, they go to the beach, but they get sick because the thing we need to be aware of, it's in the community, Regina. It's a community spread. The
Mm-hmm.
other update I would like to share is experts have talked about this, and I'm like, I think I get, like, we all do a bazillion emails about this, being on so many committees and stuff like that. One of the things is, be careful when you use a toilet, people, because now a public toilet, not the one in your house, because this seems gross, but we have to talk about it, because now they are saying an infected person can even shed the virus, and when the toilet is flushed, the aerosol spread is there in the atmosphere for a longer time, Regina.
Yes.
And I know, and if somebody goes, that's another way. So the problem with the disease is, one, we don't have a vaccine. Two, we don't have herd immunity, Regina. You know that as a healthcare professional,
Mm-hmm.
how important herd immunity is in protecting the rest of the people. Now, why don't we have it? Because we don't have 70% infected, and we don't have 70% of those infected living. You
They
see?
have died out.
So
Yes.
that's the problem. And the other issue we have is, people, we have asymptomatic carriers. So
Yes.
I mean, like, you know what? I really want to go for a massage. I want to go to my hair dresser. So that's why
Mhm.
I bunched my hair back in a ponytail, because it looks a lot better. But it's not how you look, it's how well you are. And I love that somebody tweeted, if you hate a mask, you'll hate a ventilator more.
Yes.
So you know that. I know that. So what I'm trying to say is, there's nothing which is a shortcut. And also, ladies, gentlemen, it's not sounding neurotic. People think I'm neurotic if I tell them that. But make sure you wash everything you bring in from the supermarket too,
Mm-hmm.
because you don't know how it's being transmitted. And one of my friends, the former president of MWIA, Dr. Bettina Fleiderer from Germany, just sent me a message that in Germany, there's a local outbreak in her town, which was traced to a slaughterhouse.
Slaughterhouse.
So the same thing happened in Beijing. Do you see? It came from the person, the food people, and in one particular meat factory, the same thing happened even in the United States. So we need to be very, very careful in washing, in cooking. This is, I can't stress it enough. So the latest updates, according to the CDC in the United States, we may even have more, so many more cases than what is there because of the asymptomatic spread. And the WHO has given a very dire warning: in the next couple of days, we could be reaching 8 million, which is terrible. 8 to 10 million,
Yes, Dr. Mini. It looks like there's no way out. How long does this virus live? What is the projection? They say, before we were expecting that it will die out, the curve will, go down, and
Yes,
truly
yes.
we had fewer admissions in the hospital. But what we're noticing is that with the protesters going out, with the lift of the lockdown, with everybody out, there is a slow rise up, especially in communities where people don't care about social distancing and face masks. We have massive infection numbers in those areas. What do you project? Is there going to be a second wave with the flu season? Because this is if we're expecting a second wave in the flu season, we would do well to start preparing for it now. Can you talk about that before we talk about how to really fortify and prepare ourselves through the oncoming flu season? Because before we know it, summer will be over.
Thank you, Regina. I mean, according to experts, what is happening is, there is a wave coming. Now, the difference it may be from the first wave is, it may affect younger people,
Yeah.
as we are seeing. The symptoms may or may not be, because please remember, Regina, and all our viewers, nothing is set in stone,
Mhm.
because they have found Some people, why do they recover? Because of the strain of COVID. Some of
Yes.
the strains are more virulent than the other. You cannot predict which strain will come to a person, you know.
Yes.
It is just like hitting the genetic lottery. So you get what I'm saying.
Yes.
So here it's the COVID unlucky lottery, right?
Oh
So
Lord.
what I'm trying to say, no, it's not that I'm joking, but what I'm trying to say here, yes, we may have a second wave, but we may have little clusters
Yes.
much before the so-called second wave. And according to experts who are saying, like, you know, starting like September, October, when the weather changes in the northern hemisphere, when it gets colder, again, we may see cases, because the whole thing is a drift. You see, it started in China, it
Mm-hmm.
went to other parts of Asia, it went to Australia, Europe, then it came to us. And now, unfortunately, it's in Australia and India. And look at Brazil. Brazil is in the top infective country now
They're
in
not
the
doing
number of
well.
new cases.
Yes.
And in India too. You know, I'm talking to my friends and relatives in India who say this is the thing. You said it very rightly. People go out because you feel you're in a jail. Like, I know my daughter said some people she know went to Florida, and I go like, whoa, what is the likelihood of getting a vaccine for COVID-19 from one of your viewers? I see that.
Yeah.
There are so many people working on it. There are trials, and according to the updates, the Oxford trial seems to be a little more ahead than compared to the others. But please remember that in order for a vaccine to be given publicly to the public, the reason I say publicly, it has to pass certain safety measures
Yes.
before it is certified. That's why you have multi country trials now with volunteers who are volunteering to get this.
Yes.
So there are so many things. And then there was another message from a friend of mine at Taiwan who said that they are just coming up with, you get the immediate test result. And let me tell you, Taiwan has done an amazing job
I
in
control.
keeping COVID at bay,
Yeah.
as has Kerala, a state in India. Why? Because they started acting before they used masks. And the other
Everybody.
thing I
Yeah.
want to share, in Kerala, for social distancing in rural areas, they gave people, the local governments gave umbrellas. So when you hold up an umbrella, you're 6 feet away.
Oh,
So this is
okay.
something people in Nigeria can do. Like, if you hold up an umbrella, if I was going shopping, if I lived there, I would hold up an umbrella, have my mask and gloves, and I would have somebody before me, but with maintaining the social distance. You see, using the locally available things, and it's
Yes.
very easy. Most households have an umbrella, don't they? If they
Yes.
don't, the local government can invest and give it. So this is what I'm trying to say, how we work. And the other thing is masks, masks, masks.
Mm-hmm. Yes.
And wash your hands. Like, you know, my hands are so rough, because as yours too, because we are washing them and washing them.
Yes.
But rather it's rough and you put some lotion in the night or oil instead of, you know, not washing them.
Yes.
And there's another thing, a comment. It says, it baffles me that a lot of people are in denial. Yes, it
Mm-hmm.
baffles all of us.
Yes.
And you know what, Regina, you're a healthcare provider. People go like, oh, I wore a mask yesterday, it stifled me. I said, join the club. We wear masks and goggles and things when we are caring for patients. So what about us? And
Yes.
people think your oxygen level falls. It does not. It does not, folks. Just by wearing a mask, it's your the oxygen in your oxygenation process to your body by your lungs is not coming down. Because if you get COVID, it's really like a death knell for some people.
Yes.
So I can't stress this enough. Like, my hairdresser Regina told me, I'm open. I said, hello, I will see you in August, because I don't care how I look. I want to
Yes.
stay healthy. I want my daughter
Yes.
to stay healthy. I want my family to stay healthy. I want all of us to stay well, healthy. And also, there's a comment that Nigeria may be heading for a second lockdown.
Yes.
Texas now has a lockdown. You saw that, right? They want
Mm-hmm.
everybody to stay in. And
Mm-hmm.
New York, for us, New York, New Jersey, Connecticut, they have a 14-day quarantine now for
Yes.
people who are coming from the infected states, the
Yes.
most infected states. So, guys, we have, ladies, gentlemen, we have to do our best. We need to have that self-discipline so that we say, no, I'm not going to give in to the temptation of saying, I don't care. And none of us is invincible against COVID. There's nobody who can say, I will
Mm-hmm.
not get COVID and sign their name in blood, right?
Mm-hmm.
You can't say that. So,
Yes.
what I would like to say is we need to be careful. We need to be strong. We need to be optimistic, stay in touch, but please don't be foolhardy. Masks,
We have a
washing.
question. The gentleman here at Aikide. He's running a 1 million face mask campaign for Nigerians. He's running a program to gather a
Excellent.
million face masks and distribute to local governments and people in the villages in Nigeria. And we commend him for that. I'm going to ask him to come on and say a few things about that to encourage participants. And also, Dr. Mini, there's a question here for you about vitamin D. Please, can you address this? We still have a few more minutes. Yes.
Okay, thank you so much. I think that is from Miss Blesso Ekwe. I hope I pronounced her name right.
Uh-huh.
Thank you so much for your question, ma'am. The thing with any vitamin, vitamin D, other vitamins, doing yoga, all these boost your immunity. So I would say it could decrease the risk of your getting COVID by making you more immune or helping you to maybe mitigate the effects of COVID, but there's nothing which can really prevent it. Okay, and then it says, why is the virus not diminishing now that the weather is hot? Because the virus, like other viruses, is not affected by temperature. Remember, when it first started in Australia, it was hot, you know.
We're being told that it dies at a particular
Yeah,
temperature.
but let me say that. But
Yes.
it's shown the strain. So I was just
Oh,
going to
yes, you
come
said
for
that.
that.
Yes.
So there are different strains. That's why I was trying to say. So maybe some strains are not that susceptible to heat. That's what
Yes.
I was trying to say. You
Yes.
know, that is a thing. This is something we're all learning and grappling in the dark. So that's why having programs like Regina the Great does with the COVID connectivity. You love that name, don't you? So connectivity, connectedness in COVID really helps us understand. And what is defiance? I don't know. Oh, what does Bill say? What is defiance? A
Why
normal
is
reaction.
defiance a normal reaction to health emergency?
Why is defiance?
Yeah.
That's because we all don't like to be told what to do. When you were a child, Bill, if your mom told you to brush your teeth in the night, you'd say, I did it, mom. But half the time you went, well, I did that. But later on, I realized the importance of brushing my teeth or washing behind my ears. So I think it is a normal biological action because we all think we are in control. And one of the things is the virus is in control here, folks, not us. We can keep it at bay by following principles of common sense and cleanliness. Like, okay, if you step out and come back, please change your clothes. Wash your clothes with bleach because bleach is a good killer. So this is what I'm saying. And Regina, I'm sure like when you come back, you change your clothes. You don't want
Yes.
and take a
We have a
shower.
whole ritual
Yeah.
for that.
Yes. Yeah, that's what I'm saying. Even your shoes, you don't bring in the same shoes inside. You just put them out. You don't walk in your kitchen or your living room with those shoes you wear out. So it's common sense. So, oh, Bill goes, how did you know? I guess, Bill, because I know you.
Oh my goodness. It's been such an interesting interaction
Thank
with
you
you.
so much.
Thank you for coming to share this knowledge with us. And I'll be calling on you from time to time for updates on what is
Oh,
going on,
definitely. My
right?
pleasure. And I will share this information about the virtual event with you.
Okay. All
Thank
right.
you.
Thank you
Bye.
so much. Thank you to all our viewers. As a last word,
Thank you.
Dr. Mini, please close out with our viewers, and we thank you for your participation.
Thank you, Thank you, everybody. Stay safe.
All right. Okay. All right.
Oh, there's a
So,
last question, Regina.
Uh-huh.
It says, okay, so from Jane, she's Nwaka. I hope I pronounced your name right. I
Mm.
apologize if I didn't. It says, how do we breathe in oxygen when our nose is covered? Because your nose is not fully covered. It is a protection. And even then, you can breathe in, the carbon dioxide goes out. It's not harmful. So that's what I just said. You do not get hypoxia. That means the oxygen levels in your blood do not fall just by wearing a mask, because it's not that everything is covered. It's just a mask which protects you, so that if somebody sneezes, you are protected from that droplet infection, but you are still getting air. Let me tell you, I speak for Regina and myself. As healthcare providers, we've been wearing masks for a long time. We have not dropped dead by wearing a mask. So I understand your question. I understand your concern, but believe me, it's safer to wear a mask. Nobody's asking you to wear a mask in your house. You're wearing, and also those of you who have elderly parents, elderly relatives, we need to be even more careful, or with pre-existing conditions. So thank you again. Stay safe. Bye.
Thank you
Thank
so
you.
much. Have a beautiful day.
You too.
Thank
Safe
you.
weekend. Talk to you soon. Thank you. Bye bye.
All right. Bye-bye. Okay, I'm sure we all learned a thing or two about how to protect ourselves in the COVID situation, and also how to speak up. You know, we have been encouraged to speak up if you're a victim of sexual violence or domestic violence or rape or what have you. Please, you have been advised to speak up. Connect to the places that are always open. Do I have Atta in the studio? Connect to the places that are always open. Connect with your pharmacy, with the police department. Stay online. I applaud the Nigerians who have been going online to make a statement, you know, to speak up against what has happened to them. All right. And I expect that the Nigerian government will give them more support. I have Mr. Atta Ikide online with me to speak on the 1 million face mask campaign for Nigerians. Briefly, please, Atta, you're welcome to the studio. You heard Dr. Mini talk about the importance of the face mask and the expected second wave of infection that is coming, and the different strains of virus that of the coronavirus we have now. Please say a few words on the 1 million face mask for Nigeria's campaign, and we'll take it from there. Thank you very much for joining us.
Regina, let me first of all thank you for a wonderful work that you're doing.
Thank you.
I can tell you that every Saturday there are Nigerians who wait for you to come online and
Oh,
listen and educate us. So well done.
oh, thank you.
Before I talk about the 1 million face mask campaign,
Mm-hmm.
I want every Nigerian who is listening to this to please Google and listen to what the chairman of the Presidential COVID-19 Task Force said a few days ago.
Mm-hmm.
And that is that in 3 weeks, that the number of coronavirus victims in Nigeria is going to double. He didn't say may double. He said is going to double. At the moment, Nigeria is recording 600 cases a day on the average. In fact, 2 Thursdays ago, we had 700 cases, COVID-19 cases. And yesterday, he went further. He said Nigeria is heading for a third lockdown. Regina, people are dying.
I know.
People
Every
are
time
dying.
you turn around, there's news of somebody lost to COVID. So sad.
Nigeria may be heading the way of Brazil, God forbid, where you have like, thousands of people a day falling victim. And what is most sad about all this, Regina, is that Nigerians are not taking this seriously.
Mm-hmm.
On the streets of Abuja and Lagos, these are cities that should lead the way On the streets of Abuja and Lagos, there are people walking around without their face mask.
Mm-hmm.
There are people walking around without the hand sanitizer. There are people in the marketplaces and in the shops and who are not observing social distancing.
That is so sad.
Nigeria has a 3-week window right now.
3-week window.
Yes, 3-week window. According to the chairman of the Presidential Task Force on COVID 19, 3-week window. And if we're recording 600 cases now,
Yes.
believe me, in 3 weeks, we might be recording 1,200 cases a day of infected people. Seriously.
This is serious. Yes.
And Regina, Nigerians are not taking this seriously.
And we must do something about
Nigerians
it.
still
Yes.
believe that this is an American sickness. They still believe it's a Chinese flu. They still believe it's something from Europe. Now, listen, we thought that the heat, remember initially,
Yes.
the numbers were very low.
Yes.
And there was this theory that it was the heat, it was the sun.
But
Regina,
Dr. Murphy has just dispelled that. He says that different strains, different strains.
yes,
Some are not reacting to heat.
that's it. And Brazil is hotter than Nigeria. And in Brazil, you have thousands and thousands of cases. Brazil just crossed the 1 million mark of infected persons.
Oh dear.
So we have to be careful, Regina.
Yes.
And so the 1 million face mask is a project to get Nigerians involved, to distribute
Mhm.
free face masks to Nigerians and
Yeah.
to educate Nigerians. You see, listen, this is just the first wave. The second wave might come between August and December. And if we go by what happened in 1918,
Yes.
the second wave was actually deadlier than the first wave. Now, look
Mm-hmm.
at what is happening in Texas right now. I mean, look at the number of infected people in Texas at the moment. The
Yes.
second wave. So, this project, I mean, and we've had, I tell you something, we've had amazing people come up with videos because part of this educational process
Yes.
is to reach out to the rural areas, and that's
Mm-hmm.
why we've asked people to come up with videos in
Yes. Let me talk
vernacular,
about the videos. Yes.
yes, in their native tongue, and we've
Yes.
had so many videos.
Yeah.
And Friday, today was actually the closing day, but if
You have to
there's any,
extend it because people are asking, where can we send their videos? Where can they send their videos?
good,
Yeah.
good, if there's anybody out there, please, you do a 1 minute video, a
Yes.
1 to 2 minute video on COVID 19. The video must have 3 messages: compulsory hand washing, compulsory face mask, and social distancing. And you stand a chance of winning 30,000 naira if you're chosen as the winner from your region.
Yes.
So it's not too late. Today's the closing day. But you know what? I'm going to extend this one extra day to Saturday. So you can bring in your videos, send your video to me, Ata Ikide. I'm on Facebook. Send it to my Facebook Messenger, Ata Ikide, ATAIKIDDEH. Or send it to Regina Asker Williams. She's
Yeah.
also a part of
Yeah.
this great and wonderful campaign. So, Nigerians, please, we have a 3-week window. They have warned us that we might see this coronavirus pandemic hit a lot of people. Today, Regina,
Mm-hmm.
I just read the governor of Delta State, his daughter, one of his daughters, has been infected with the coronavirus.
Oh dear.
Oh,
Okay.
yes, the governor of Delta State. And of course, we had what happened to the former governor of, was it Ogun or your state?
Or your state. A
or
friend of
your state,
mine. Yeah.
Ajimobi,
Yeah.
he died of coronavirus complications. So this is not something we should play with. This is not something
Yeah.
we should joke with. So Nigerians, please
Sit up.
beware.
Yes.
Thank you so much, Regina. Thank you.
Thank you. Thank you for coming on and sharing this. I encourage everybody to participate robustly in this campaign. Let us get the word out there. Let us educate people. And please send in your videos and send it to me if you can't make it before Saturday. Okay? All
Thank you
right,
so
then.
much,
Thank
Regina.
you. It was great having you with us.
Thank you.
All
Thank
right.
you. Thank
Have
you.
a beautiful day.
Same.
Okay, everybody, thank you for your participation. Thank you for spending your afternoon with us. I am looking forward to speaking with Queen Chama Agatu, and have been waiting for her to join us in the studio. I'm going to take 5 minutes off and try to connect with her and get her back, and hopefully you'll spend more time with us when she's back. I want her to talk about Nigeria. Talk to me about Biafra, the issues of insecurity, what she thinks could be done to alleviate the situations, the violent situations, the rape situations in Nigeria. I want her to also talk to me about an African immigrant, what it takes for an African immigrant to be successful out here in America or the United Kingdom or any place else out of Africa. Because it looks like we sometimes end up with the shorter end of the stick in terms of considerations at our employment, avenues to grow, okay, to climb up the ladder, unfair treatment, unfair practices, catching the heavier workload, and not being able to avail yourself of promotions. And she has been in these situations, and I hope that she'll be able to come onto the program and talk with us about this. Okay, till then, please, I'd like to say good night and God bless. Take care of yourselves and of each other. And please remember to practice the COVID social etiquette. Hand washing, not just to spritz in the water and go. Wash your hands, wash in between, wash the tips of your fingers, wash under the tap, soap and water. Sing the happy birthday song 2 times. Okay, that will make 20 seconds. Sing it 2 times and then you're good. Use your face mask because this virus is spread through coughing, through droplets from coughing, or it suspends in the air if it's in aerosolized conditions, okay? We now hear that heat cannot kill it or cannot kill some of it. So the best bet is to protect yourself. Use your face mask. It prevents the virus from coming out and it prevents you from breathing it in, okay? The last thing after hand washing, face masks is social distancing. I like to say 6 feet apart or 6 feet deep. People, we are not sure of whatever conspiracy theory is making the rounds. We know that there's a virus out there that's killing people. So the most intelligent thing that we can do to help ourselves and our communities is to take into consideration the COVID-19 social etiquette. Please take it seriously. We have lost too many friends, okay? We have lost too many people. Too many major people in Nigeria have passed, not to mention the ones we don't know about. So please stay on top of it, okay? Take it seriously, right? Until I'm able to come back with Queen, I will say see you soon. If I'm not able to come back with her, I will see you next week, all right? Go to superstars2020.com and participate in the competition. Go to Atai Kide's face wall, Facebook wall, on my Facebook wall to participate in the 1 million, the campaign for 1 million face masks for Nigerians, and also my nurses, the RAIN project to perfect the practice of nursing in Nigeria. The RAIN 2020 project is ongoing. Visit our websites and participate, okay? This is Regina Askia signing out. Till next week, Saturday, take care of yourselves and of each other. I'm coming to you tomorrow. Tomorrow is Saturday. I'm coming with you with a program on Saturday also. Till then, please take care of yourselves and of each other. Much love. Thank you. Okay, what happened to Queen? What happened to Queen?